If you're newly pregnant or you're planning to be pregnant, then you're in the right place, because today I'm going to be answering some common questions that is asked in pregnancy, some common concerns or questions asked in your first trimester. Today I'm going to be dealing with some of the questions. Normally I make video and I see numerous questions, so today I just say let me address some questions that normally comes up in my comment section. So you're in the right place. Hello, beautiful people. My name is Daisy Peter. I'm a content creator based in Port Harcourt. If you're new, you're welcome. All we do here is give pregnancy tips, tips for your healthy baby, and tips for motherhood. If you're yet to subscribe, please, I want you to hit the subscription button, like, share, and comment. Thank you. Let's get into it. So the very first question on my list is, what is first trimester and how long does it last? This is one of the commonly asked questions in my comment section. So I will say that first trimester is the first 12 weeks of your pregnancy. Normally in the medical term, they calculate by weeks and not by months. So don't be confused when we say weeks. So in a layman's term, your first trimester is the first 3 months of your pregnancy. And the first trimester is when your baby's organ are still forming, and it's a very super important aspect of pregnancy, because then you might not even know that you're pregnant. It is the early stage of pregnant most times. Until you even do your pregnancy test to confirm that you're pregnant, that's when you might not start noticing the signs and the symptoms, because the mind really has a way to play with our emotions. So once you confirm that you're pregnant in this stage, maybe that's when you will not start noticing the signs and symptoms. But in a case where you don't even do the test, you might not even know that you're pregnant. So this is what first trimester is all about. It's the first time that you're just taking in the first 12 months of you being pregnant, and it is the most crucial part of it, because that is when your baby is still growing, your baby's organ are still developing. And the first trimester is one of the most delicate trimester in your pregnancy journey, because the foundation of everything matters a lot. So it is the forming foundation of your baby. Another most common question that I normally get in my comment section is, what are the symptoms of the first trimester? What are the things you're going to notice the moment you found out that you're pregnant? One of them is morning sickness. Like I told you before in my previous videos, that morning sickness does not necessarily mean the sickness will come in the morning. It can come anytime. It's just the general illness, you sleeping, always getting tired. This is called the morning sickness. It can come in the morning, it can come in the afternoon, it can come in the evening. Another common symptoms of this first trimester is vomiting. You always be vomiting, especially in the morning, you just be vomiting. So it's another symptoms of first trimester. Another one is laziness and sleeping. Every now and then, every 5 minutes, you just fall asleep. It's another signs of the first trimester. Another one is fatigue. You're always tired. Every time you're always tired. Every time you're always tired. When you're asked to do a little thing or walk a small distance, you see yourself getting tired. So when this happens, know that you're in your first trimester. Another symptoms of your first trimester is frequent urination. Every now and then you're going to the toilet to urinate. So when you notice all these signs, just know that you're in your first trimester of your pregnancy. Though the symptoms might vary from one person to another, everybody do not experience the same symptoms of this first trimester. There are some people that do not vomit. And another one again is this spitting. Yes, some people spit a lot, but there are some people too that do not spit. So that's why I said that it varies. We are different, so our body system is different. There are some symptoms that one pregnant woman will be noticing, you will not notice it. But in all of these symptoms I've mentioned, one or two will be common. Is either you're having morning sickness, or you're vomiting, or you're spitting, or you're sleeping, or you're feeling tired. So these are the symptoms to look out for in your first trimester, in your first 3 months or your 12 weeks of pregnancy. The number three question is, what food should I avoid in my first trimester? If you're pregnant, there are some certain food that you're not supposed to take because of the health of your baby. It might not be harmful to you, but for the sake of your baby, if you eat this food, they may be harmful to your baby. One of the foods you should avoid when you're in your first trimester is uncooked or raw food, high mercury fish like swordfish, caffeine, alcohol, cigarettes, unhealthy food. Stay away from them when you're pregnant. Please make sure you find yourself rich diet food. Eat cooked food, eat food that are rich in calcium, eat food that are rich in protein. You have your Greek yogurt, you have your egg, you have your cooked food, you have your leafy greens, you have your vegetables, you have your avocados. All these food are very good for you in pregnancy. Another most asked question in my comment section about pregnancy is, that's the number fourth question. Do I need to take my prenatal vitamins? Yes, your prenatal vitamin is very important in your first trimester. Your prenatal vitamins are like the folic acid, the bico, the fesolate, and your vitamin C. All these are very essential for the growth of your baby. Remember, I told you that the first trimester of your pregnancy lays the foundation of your baby's growth, because that is the developmental stage of your baby. So please endeavor to take your prenatal vitamins. I know that there are some people that complain that they don't like the smell, because as a pregnant woman, we are triggered by smells of different kind of things. You might not really like the smell of these prenatal vitamins, but please endeavor to take your prenatal vitamins, because it will help in the development of your baby, in the development of your baby's organ, development of your baby's brain. Please don't skip your prenatal vitamins. The number five question is, when should I schedule my first doctor's visit? Commonly, most people like scheduling their first prenatal visit around 8 weeks of pregnancy. But once you test positive, once you've confirmed that you're pregnant, call your doctor immediately and they will schedule you for your first antenatal visit. Especially for first time mothers, please do not waste time. Once you just confirm that you're pregnant, call your hospital so that they can start a follow-up immediately. They can run scan so that they can run scan to confirm if everything is in order. So the best time to call your doctor, the best time to start your prenatal visit is when you confirm you're pregnant. Call your doctor immediately. They will schedule you for your prenatal visit. The number six commonly asked question is spotting normal in my first trimester? Yes, spotting is normal in your first trimester. You might be wondering what is spotting as a new mom. Spotting is very normal in your first trimester, especially when it is not heavy, when it is not thick. If it's light, that is when it's called spotting. But if it comes like normal menstrual period for days, please contact your doctor immediately. It becomes abnormal when the spotting becomes plenty, when it becomes thicker, and when it is no longer light. But in a situation where it comes only small, it is very normal. I experienced it. Some other mothers experience it. Spotting is very normal in your first trimester. The number seventh commonly asked question is, can I exercise in my pregnancy? Is exercise good for my pregnancy? Yes, exercise is very good in your first trimester, especially mild exercise. I already made videos on the kind of exercise that you should engage in as a pregnant person. You have simple exercise like swimming, your yoga, your meditation, morning strolling. All these are exercise good for your baby. Like I told you that exercise in pregnancy helps your baby to be energetic. It boosts your baby's brain. It makes your baby to be smart. Endeavor not to miss any of your exercises. And even exercise also help you to heal faster after delivery. So all this mild and small exercise is very good for you in your first trimester. But please do not engage in heavy exercise. Do not engage in strenuous exercise, because they can cause miscarriage in your first trimester. So if you want to do your exercise, if you're this kind of person that you've been doing exercise and you just got pregnant and you still want to continue, please mild exercise like yoga, swimming, meditation will be very good for you, because after each exercise, it will make you to have a good rest. Like those of you that always complain of insomnia too in pregnancy, exercise can help to reduce insomnia in pregnancy. After each exercise, it might put you to a nice sleep. And lastly for today, One of the most commonly asked question is it normal to have stomach cramps in my first trimester? The answer is yes. Stomach cramp in pregnancy is very normal in your first trimester. You're supposed to have some mild stomach cramp in your first trimester. Some people even confuse this for menstrual pain, especially those that have not run their test to confirm that they are positive. They might be feeling that this is period that is going to come. It could be that you're actually pregnant. So stomach cramp is very normal in pregnancy in your first trimester. But mind you, once this stomach cramp becomes very severe, it doesn't end, please call the attention of your hospital. It might lead to miscarriage. But if it is mild, it is very normal in your first trimester. So that is one of the most commonly asked questions that I've normally seen in my comment section. Maybe I will still be looking out for more to respond to. And please mind you, all my answers I've given here are based on personal experience and research. I'm not a medical doctor. All I teach here is based on my personal experience and research. You can still do well to call your doctor. If you've watched to this extent, it means that you found value in this. Please, I will want you to like, comment, share. And for those who have always been coming around and you've not hit the subscription button, please, I want you to hit the subscription button and share this to other new moms who might be wondering or asking these questions you just asked now and I've given you answer. Thanks for saying. See you in my next one. Bye.